Wanted to have the opportunity this morning to demonstrate all what you need to perform a nanoscope here in the operating room or in the office. It's impressive, as you can see what's on the table here really lets you take throughout the entire phases of care the little that you need for preparation, then the camera and even the equipment here for instrumenting a knee or a shoulder or other joints. I do want to talk a little bit about the instrumentation to access the joint. You can see on the top right side of the table are the tools that we use to place the nanoscope. You can see everything can be done through placement with a spinal needle and a guide wire, and then what's placed over the top is this disposable obturator and cannula system. I think it's important to mention and emphasize how atraumatic and small this is relative to our conventional tools. As all of us know in the OR with our routine quote-unquote 3.5 millimeter scopes, the outer diameter of those cannulas is 6.5 millimeters and very large, and correspondingly the tools that we use to instrument are quite large. This is an outer diameter sheath of 3.0, and all of the instrumentation here that is going into the knee joint is 2.0. As you can see, accessing here with the nanoscope itself, it's a 1.9 millimeter camera with an outer 2.2 millimeter sheath. So that is about a third of the size of the routine instrumentation that we're currently using. And that, of course, offers several advantages. Number one, first and foremost, minimal trauma to the soft tissue, but of course, an ability to access pathology and see things in the knee joint without iatrogenic injury to the cartilage in ways that we never have been able to before. So again, just emphasizing those points here, the 2.0 millimeter or 2.2 millimeter outer diameter of these instruments and 2 millimeter instruments in terms of probes, biters, and graspers. Here are the two syringes that come in the prep kit. Here's the disposable 11 blade for access into the joint. Here are your ACE wrap, sterile drape, and sterile towel, as well as gauze. And all of that comes in the prep kit. And then moving forward here, your access kit, which will involve your spinal needle, your guide wire, as well as your disposable obturator and cannula, and then the adhesive custom Tegaderm that allows you to secure the cannula to the knee joint to avoid loss of access during the case.